It's important that staff, patients and consumers have trust and confidence in our services and its processes. During our day-to-day work, we are frequently exposed to confidential information. It could be a patient's personal details, those of other staff members, or other information that relates to either our work activities or organisations that we deal with. We all have a responsibility to respect the confidentiality of private or privileged information and to show responsible and ethical behaviour in our communication and use of that information. It's through having strong processes and principles around confidentiality that we can build and maintain trust with patients and communities. It's a good idea to ask yourself, how would I feel about the health service having access to my private details if I couldn't be sure my personal information was confidential? Patients, consumers and stakeholders have an expectation that any private information or data will be treated appropriately. And it's not just patient information we need to keep confidential. It can be any information that you come into contact with in the course of your work, including things you might see and hear. When you're discussing work-related information with a colleague, consider your surroundings. Think about whether your conversation could be overheard, like talking in a corridor, taking a call on public transport, or having a chat at the shops. In so much of what we do every day, there are checks and balances in place to maintain privacy and confidentiality. For example, our computer systems are regularly audited to ensure appropriate access to information and records. In certain cases, breaching confidentiality can be treated as a criminal offence. And when inappropriate access is identified, it could be referred to the WA Police or the Corruption and Crime Commission. So just to recap, remember to only access computer systems and information where you need to as part of your role. Only discuss personal information about staff or clients where you need to as part of your role. Never release or discuss confidential information without the express authorization of an appropriate person through the appropriate channels. And when discussing confidential information, make sure you are in an appropriate place. To help support you and raise awareness of risks and your obligations, there is a dedicated confidentiality e-learning program available in My Learning. Remember, if you see, hear, or read something while you're at work, have a think about your confidentiality obligations before you deal with that information. More information about confidentiality can be found on our WACS Integrity Unit intranet page.